Welcome to Good Friends, Good Medicine, East Meets West. What are we? July 13. Welcome to my good friend, TJ Frank. How you doing, buddy?
Doing good, brother. Aloha.
Aloha.
Checking in from Maui. And I'm breaking the day of my practice to share with you and the world my experience with carpal tunnel.
Very good. Yes. Carpal Tunnel. Oh, this should be very interesting. I'm looking forward to it. All right. What do we got? If you like this, I'll do a little call out. If you do like this show, share it around on Facebook and the social media stuff. If you feel inclined, we're very grateful that you may join us. So yeah, carpal tunnel. Should we follow the usual routine? West first, Western diagnostics. Let's do that.
Please.
Okay. So I've got some interesting epidemiology here that I'd throw out. So carpal tunnel syndrome, virtually unknown in some cultures, particularly Southern Africa, and much more prevalent in white-skinned people. So that was an interesting one for me. Also, it does happen in pregnancy as well, thought to be due to increased edema, and the overall general feature of carpal tunnel syndrome is that, from my perspective, it's compression on the median nerve as it passes under the flexor retinaculum in the wrist, and gives some characteristic symptoms, but apparently in severe cases, actually leads to the nerve degenerating and demyelinating. So continual pressure on the median nerve, and then the symptoms are going to be related to the areas that the median nerve supplies. So kind of typical history features would be things like pins and needles in the hands, and particularly at nighttime. So the thought is that as we sleep, the hands kind of compress, and I'd be interested to see your perspective on why the hands might do that, TJ, when we get to that. Intermittent aching, and also loss of fine motor grip. So people might find them dropping things without knowing it, which was really interesting. And also some characteristically with driving, for some reason. I wouldn't have thought that that's putting pressure like this, but somehow in the driving of the steering wheel, I've certainly seen patients describe carpal tunnel come on when driving. From a differential point of view, for me, are there other causes that could be involved in this? So things, for instance, like alcoholism that damages the nerves, edema, increased edema, as mentioned in the pregnancy. Diabetes could be a cause of this, so high blood sugar damaging the nerve. And they may well have like a glove and foot kind of distribution, and then possibly some vitamin deficiencies, so B6 or B12 deficiencies. So they'd be interesting kind of other causes of this. And then also there is some relation to work as well. So if people are doing maybe repetitive work where it's jackhammering the hand, that the manual labor with repetitive banging through the wrists, that may well be a cause as well. So occasionally we see it in sort of workers' compensation cases. Examination-wise, nothing hugely specific that works really well, but there are a couple of classic tests. One is called Phelan's test, and basically you hold the hands like this for 60 seconds and see if it recreates the symptoms. You can tap on the median nerve, but I mean, that's fairly non-specific. I mean, I'm getting symptoms just by doing that myself, so I don't really think that's great. And then the other thing is it coming from higher up? Is it coming from higher up in the neck as the brachial plexus comes down? Or possibly, I saw this mentioned, but I couldn't really understand it that well. They were like, is it from a epicondylitis at the elbow, which was really peculiar from from a physiological point of view. It's like, okay, maybe there's inflammation coming as the nerves come through here, and that's giving the symptoms down there. I'm sure you've got some more for us around that in terms of a meridian-based model, so I'm interested in that. Yeah, and then investigation-wise, so probably the key test is going to be around like a nerve conduction studies. Would be classically show a decreased nerve function as it goes through underneath the flexor retinaculum. But hopefully, I'd certainly be interested to see the course of the entire structure rather than just at the actual at the nerve at the wrist itself. So hopefully, and typically when we do them over here, we get a rundown of the entire arm. There is some possible role for ultrasound, for MRI, if you're kind of suspecting a lesion there, possibly some kind of ganglion pressing on the nerve, but I would like to be able to palpate that before I went. Certainly going to MRI. MRI is expensive. Ultrasound, we'll get into a little bit with treatment, but ultrasound they speak of in terms of ultrasound guided injections, so they could have a look there. But I think that's pretty uncommon, and usually I think the ultrasound shows like increased edema or increased pressure through the area. So that's kind of like a rundown of carpal tunnel syndrome. The other interesting thing for me when I looked at this, I'm like, God, one more of these syndromes, like it's really interesting in terms of, you've spoken about it before, like the renaming of the symptoms into Latin. And again, the carpal tunnel syndrome, I'm like, God, all right, we can see that there's pressure and they can see that the nerve is affected, but what's going on behind that is an interesting question that I didn't have great answers for. Yeah, mate. So that's what I've got from a Western perspective for carpal tunnel syndrome. How's it looking from a Chinese perspective?
Right on. Thanks, Tom. We have a very similar list of causes for carpal tunnel. The general physiology of it is quite the same as far as the recognition of a nerve that comes from C567, C56, that goes from the vertebrae of the neck and then goes into a bundle, the cervical plexus. And then it goes behind the head of the SCM, goes under the clavicle, between the clavicle and the first rib, and then it follows under the pec group, under coracobrachialis, at the right at the muscle bundle of the shoulder, and then it goes right under biceps, through the biceps tendon, right at the center of the antecubital fossa, between palmaris longus and extensor longus, or flexor longus communis, the two tendons in the arm, through the carpal tunnel down to the three fingers, the thumb and the middle fingers. And so the nerve pathway is the same. In Chinese medicine, there's three meridians on the inside of the arm. There's the heart, small intestine that goes to the pinky, the pericardium that goes to the middle finger, and the lung that goes to the thumb. So when looking at this syndrome in general, my first thought is which meridian is going to be involved. Obviously, people mistakenly described any neuropathy in the arm as carpal tunnel, and they don't differentiate between a cervical outlet syndrome or a brachial plexus syndrome or ulnar neuropathy or a median neuropathy or radial sensory neuropathy. Typically, the people aren't educated as much to differentiate. So when somebody comes in with carpal tunnel, I first have to make sure it really is carpal tunnel and not an ulnar neuropathy or cervical plexus entrapment or what have you. Chinese medicine sees pain as the stagnation of vital body fluids, movement in the body. And it's thought that if there's a free flow of blood and qi and lymph and the ligaments and the muscles are smooth, there won't be any symptoms. And if the muscles are tight, if the ligaments are tight, if the lymph can't move, if the blood can't move, then there'll be a sensation of pain. So this is a pain condition. So my first thought is, where's the blockage? What meridian is involved? That's my first level of real differentiation in this case. Is it really carpal tunnel? What meridian's involved? Now, that being said, within the system of differential diagnosis that I've put forth in every subject we've discussed, I'll employ the same set of 8 principles. Is this something from the outside coming in or the inside coming out? Is this something hot in nature, cold in nature, yin, yang, excess, or deficient? So what that means practically, in addition to the syndromes you've put forth, we also, from a Chinese perspective, might say somebody who handles too much snow or ice or cold water could congeal the flesh of the wrist and could create carpal tunnel from continuous exposure to cold. So there's a lot of people, there's snowmobile medics, and they'll drive around with exposed wrists to the snow in the wind. I have a client who's he's an ice merchant. He has a company that produces ice, large amounts of ice, bags, sculptures, shaved ice, anything ice can do, this guy sells. And he's holding ice all day. I have another one that's a goat farmer. Now, this isn't an external, this is an internal. She's a repeated use. She milks her goats all the time. She insists on doing it by hand, and she's got tremendous neuropathies. It's repeated use. To that note, so now we're going, external causes: wind, cold, damp, dry, or heat. Usually wind, cold, and damp are the 3 that will cause carpal tunnel. Dryness and heat won't usually cause carpal tunnel. That'll cause eczema or some other condition to the hand. Wind, cold, and damp are the ones from the outside. From the inside, it could be a stagnation from a trauma. It could be that they've gotten hit, blocked, punched, crushed. Any physical trauma can create a stagnation of blood in the body that can give rise to the symptoms. And then repeated use can create grinding in the tissue and blockage and inflammation that can pinch the nerve. So that's the goat farmer. Other people that I find that have tremendous amount of carpal tunnel are computer workers, because the way they position, it traps the nerve at the neck, at the shoulder, at the costoclavicular margin, at the elbow, it blocks it at all of them. Driving as well, because the positioning of the arm blocks it at the cervical plexus, at the brachial plexus, at the median, at the elbow, and at the wrist. And then interestingly, some of the worst I get to see are keyboard players, professional keyboarders.
Really?
I would have thought drummers, or I would have thought violin. They don't get it as bad, the keyboarders, with the arms going up and down in the irregular position as though they were driving. Keyboard players, which, a keyboard player, computer people do that too, right? Yeah. All right, so that's one of the internal causes, is repeated use creating stagnation of qi in blood, is how the Chinese would call that. These are the people that you'll know it's fixed pain, it's stabbing pain, it's worse with pressure, it's purple, it's blue, they have a choppy pulse, a purple-blue tongue. The external people, they're going to get worse when it's cold, worse when it's damp, and they're not going to want to go outside much, and they can protect themselves from the wind. External people will have a floating pulse. Internal stagnation people are going to have a choppy pulse. Other causes of internal stagnation so this is a cool subject, the carpal tunnel, because so many of the ones we've talked about were medical oriented. So I really had to rely on Chinese herbs and internal differentiation to get the proper herbs. This condition is not as much an internal organ related disease. This is more musculoskeletal orthopedic.
Yeah.
So it's mostly external cause or internal stagnation of qi and blood. Now, that's not to say there is no internal organ related. So this could be lung, heart, or small intestine, or pericardium. So what I mean by that, in Western medicine, the pericardium is the sac within which the heart sits. It's not assigned much role, it's not assigned much importance, and the only etiology around it is pericarditis, if it should get inflamed, and then it gets treated with steroids. All right, so now Chinese medicine, the pericardium is a vast and very important organ. It's responsible for protecting the heart. This is very important. It opens when somebody wants to hug. Oh, come give Auntie a hug. Help me, give me a hug! Oh, no! Those are the sound of the open-closed pericardium. So somebody who's always got a closed heart and a closed pericardium, they're not sure if they should, they're going to have a tightness along the pericardium channel, and that fibrous band will chronically be more tight, and therefore a person with that internal contraction around their emotionality will tend towards carpal tunnel more readily because the flesh is tightened from the emotional response to their environment. This could account and explain why some populations, such as South Africans, have a less incident because they hug, they dance, they fling their arms around, they've got open hearts. They hug. The Westerners, I don't know, stoic, can't come in, stoic, must work, every in order. You know, like that. It's a global cultural phenomena that could lead to an internal contraction of one meridian in predominance over another, and that could be culturally specific. If a whole bunch of people aren't sure if they should give hugs, they're going to be more pericardium tightness and therefore more carpal tunnel syndrome. Interesting to link it to emotionality.
That's awesome.
Now, ulnar neuropathy, as far as the epicondylitis causing a distal neuropathy, that's typically ulnar nerve. I mean, you could get an epicondylitis with an inflammation in the elbow strong enough to get the medial, but almost always it's going to be an ulnar nerve neuropathy.
Yeah.
And that's a whole nother thing. So, like, for instance, in the United States, we just had Trump elected. And in my personal opinion, not saying it's right, but I believe some of his behaviors are somewhat tyrannical or that of a tyrant. And therefore, anyone that had a tyrant within themselves that they were not able to show to the world, I had several people that were hidden tyrants. When this tyrant came out, their tyrant came out, and then they were trying to, I'm not good enough if I let this out, so their small intestine, which is the meridian of acceptance and assimilation, locked up. Because, oh shit, if I let this out, they won't love me. I won't be accepted. I won't be let in. The tyrant came up, and then their small intestines bolted shut, and I had a wave of ulnar neuropathies. I had a whole bunch of pinky ring finger numbness, cup drop, burning, tingling, shoulder pain around that particular event socially, politically, which is very interesting to link external event to internal health, epidemiologically speaking.
That is fascinating. Yeah, right.
Isn't that fascinating? Totally. All right, so now getting back to the organs can either be small intestine, pericardium, or lung, could leave. Now, lung, large intestine's primarily going to be radial sensory nerve. Pericardium's going to be median nerve. Heart, small intestine's going to be ulnar nerve. So just based on that alone, we have a pretty good idea of what organ needs to be treated. We'll get to treatments when we next. We're still in, differentiating what's going on. What else do I have to say on it? I mean, so we'll talk about it now. You said the main Western thing is nerve conduction velocities. You said it quite quickly, but that's really the meat and potatoes for both of our fields. Nerve conduction velocity is where you stimulate a nerve and then you put a receiving electrode distal to that, away, and you measure the distance and you see how much time, and you get time divided by distance, which gives you velocity. So you can get the velocity at which a nerve conducts electricity anywhere along the segment of a nerve. And therefore, it can be easily isolated in carpal tunnel if it's a cervical, a costoclavicular, a brachial plexus, antecubital fossa, or a true flexor retinaculum entrapment. It's really important for Western or Eastern to get a good nerve conduction velocity study. And I used to work as an electroneuroddiagnostic specialist, technician, and I did these exams, so I'm educated in them. And I had a client recently who I was treating for carpal tunnel, and she was going for a nerve study. I'm like, great. I can't wait to get the results so I can find out where the entrapment is so I can release it. And she came back and she said they only shocked it through the wrist, and they said that it was slow. I'm like, well, that doesn't say anything. It could be slow at the wrist because it's crimped at the neck, the ribs, the shoulder, or the elbow. If a garden hose is crimped anywhere along the garden hose, there'll be a lack of flow at the end of the garden hose. So be careful, folks, when you're getting a nerve conduction study. Often the technicians will do a study to prove there's a slowing in the median nerve, and they'll do a retinaculum surgery for profit, even though the neural entrapment was never at the retinaculum, because it can be slowed down at any point along the nerve root. So in any differential of median nerve neuropathy, it's really important to find out, where is the bugger being trapped? Where is it being pinched, and where is it slowing down? And then that sets us up for appropriate therapy.
And does that not get, I mean, it just welcome to American medicine? Is that like, how can you just do that? I mean, that's great. Like, all right, hang on, we've got a surgery that we know works here. We'll just test it here. Yep, okay, that's where it's busted. That's a massive assumption, surely, that when it could.
Yeah, it's a regretful thing, and often studies are used to validate therapeutic interventions. Could potentially. I was flown to Las Vegas for a weekend to learn how to do these tests after I was already performing it, because I was taught as an undergrad at UC Davis to do nerve studies, so I got the job. But after the fact, they flew me to Vegas, so I got to go to a Vegas educational workshop, which is basically a company selling these machines and showing us how we could use the machines to market a product. And then later on in life, now that I'm a clinical professional, I'm savvy enough because of that experience to say, hey, get the test. How was the test done? Oh, they did the test just to validate the procedure.
Yeah.
Now, not all studies are that way and not all technicians are that way, but that is a risk that I do want to educate people about. Make sure if you're going to get a nerve study, get the entire nerve pathway checked for conductance, not just the wrist.
There's a whole topic there for sure, but let's not go there.
This is just for differentiation. We need to figure out where is the nerve trap, because there's a lot of people that get the retinaculum cut, and first off, it wasn't median nerve, it could have been ulnar nerve.
Yeah,
that happens all the time, and it might not have been a wrist entrapment. It could have been an elbow, a chest, a rib, or a neck entrapment. There's many places. So I mean, just a prelude to therapy. I use the shotgun approach, and I just release them all.
The whole thing.
Because I can't order a nerve conduction study in this country. In China, the acupuncturist can.
Yeah,
and it's cost effective. Here I can't. So I go through the extra pain, and I just release the entire path. I just do it all. I just do the whole thing.
Pregnancy. Can we just touch on that?
Part of it's just the weight of the breast and the tissue. Pregnant women have all this weight on the front of their body. And then the back has to tighten, and it pulls on right at C5-6. It pulls on the back. It pulls on the shoulders. It's just weight. I mean, it could be edema, but come on. I mean, it takes a lot of edema to pressurize the sausage enough so the nerves don't work.
Oh yeah, no, that's
if you think of the body, it's just physicality of weight. Yeah, you get the deal. It's a simple enough explanation. Yeah,
that's right. It's not the edema at all. Yeah, because I mean, in all the other edema, like in heart failure, the edema is it's like down the feet.
What about distal edema, pedal edema? Pitting distal pedal edema. There's nothing worse than that, and you don't get peripheral neuropathies to that.
No,
unless it's diabetic related or cardio or vascular related. Hypoxia.
But that's not straight edema.
That's not straight edema. That's secondary.
Yeah, that's way better explanation. I like that. Yeah.
It's just weight. It's just weight pulling on the nerve. Physical obstruction of. So that's why it typically relieves in most people after pregnancy. Some it lingers because the nerves just got pinched too bad, or because the bones shifted out of way, or what have you.
Nice. Let's touch on therapeutics.
Yeah. All right, go for it.
So, I mean, from my perspective, one of the interesting ones is night splints. So you can get splints that prevent the contraction of the hands during the night, and these are pretty useful. To me, they work in mild, maybe up to moderate kind of carpal tunnel. And if they give relief, people are very grateful for that. Another idea possibly is therapeutic ultrasound, so ultrasounding over the nerve, and some people will get relief from that as well. But the night splint's really helpful. Going up into moderate, they're into anti-inflammatory kind of steroids, either oral or injection of steroids, presumably decreasing any of the inflammation that might be there. I don't know how excited I am about this treatment, but it is there. And then beyond that, if it's severe, and let's say that it does show the flexor retinaculum pushing in the nerve conduction, then we're into surgical. So surgical options, there's an open release and there's a laparoscopic release. The both seem to work kind of reasonably well if that's the true cause. I've definitely seen it where people have had the operation, their symptoms persist, and because it was coming from the neck or it's coming from somewhere else, or it was an ulnar nerve. Hopefully they didn't do the operation for ulnar nerve in Australia. I would have thought the ortho guys here are not going to operate for, if it was 4 and 5, hopefully, you start to get, anyway. I did look up kind of long term, and that was quite interesting in terms of, so some people will get a post-surgical scar problems. That is a risk of the operation, so they get problems from the actual scarring. And then also there is a risk of symptom recurrence down the, years down, which was, even though they cut it, presumably it reformed with scar tissue, and so eventually it built up enough, or something else was going on. But certainly they're the two main risks outside of your standard kind of surgical stuff, infection and that kind of thing. But number one, the scar pain, and then secondly that symptoms return eventually. What else we got? We could use neuropathic pain medications. You could.
You go to Neurontin?
Yeah. Look, if people are desperate, and it's debilitating.
Wow. GABA agonists?
The typical one, NDEP, which is amitriptyline, pregabalin, which is Lyrica, Neurontin is a possibility. These are, I don't know, they're in the brain, they're doing things, not really sure exactly how they work. Well, at least I'm not really sure exactly how they work. Sometimes they work great, but sometimes not much effect.
Idiosyncratic etiology.
I do, with Lyrica, it certainly relieves some people's sciatica. So I do wonder whether it's more like going in the gallbladder meridian, and maybe what's the pair for gallbladder is, the pericardium and gallbladder are in the same kind of 4, right, in terms of the flow. Let me just check that out. Triple heater, gallbladder, liver, pericardium. So anyway, is that not right?
I'm supposed to do the eastern side.
Just why Lyrica might work in terms of that. Anyway, what else have I got? Physiotherapy and change of work. So I'm wondering whether your Iceman changed work or started wearing gloves. The goat people got a machine. I'm curious around that. So lighter duties. But also physiotherapy, so I presume massage, stretches through the area would be the basis of therapy. So yeah, interesting ideas. What do you got from a Western perspective, Eastern perspective?
Well, thank you, Tom. From the Eastern therapeutics, we have 5 branches: massage therapy, acupuncture, herbs, diet, and movement therapy, Qi Gong, Tai Chi. So that's what I got. Now, within those 5 branches, like for some of the other conditions we've talked about, I described the herbs in great detail because they had greater significance and therapeutic, effect. In carpal tunnel, now the branches I find to be the most effective are massage and acupuncture. Next comes movement therapy, Qi Gong, Tai Chi, and then comes in herbs and diet. We have herbs that can help systemically. So for blood stagnation type, repeated use, fixed and stabbing, we have herbs that can promote the movement of qi in blood. Tao Huang Si Wu Tong, Shui Fu Ju Yu Tong, Yan Hu So, Wu Ling Zhi. There's single herbs and formulas that can be custom curtailed to a person to help the circulation of blood or to warm up the body to help with the symptoms. That's a very useful thing to know, that there are herbs that can congenitally work on a person, on their body setup to help them with the pain. So that's cool. Massage works really well for opening the meridians, shiatsu or tuina. And to get a nerve conduction study to find out where the blockage is really helps to curtail the session to make sure those specific areas are open. If I don't have that information, I do the whole thing. So open and massage the neck. The main points of block are under the clavicle, towards the first rib head, just below where the sternocleidomastoid muscle attaches. The nerve goes under the SCM, under the clavicle. So digging around in there and opening that up manually helps. If the skin feels cold, use heat. If the skin feels hot, use cold to open that area up. And then there's a lot of physical manipulations to open the retinaculum itself. Stripping the retinaculum and cross fiber and going down the flexor retinaculum of the wrist, and then manually stretching the retinaculum. It's a thick tissue, but it is dynamic and plastic. It can be stretched open. It doesn't have to be cut open. It can be stretched open. Wow. This is a big news. So you go cross fiber to the retinaculum, the other way.
Like this way?
That way, yeah. In one way, one the other way. So it takes two hands or two thumbs. There you go. Yeah. And then you can stretch open the retinaculum, and you can open it that way. So massage is really great. And then, the Qi Gong and the Tai Chi, flying like a crane, these big arm movements can help open it. Acupuncture is great for this particular condition. We've got pericardium 7 at the wrist, which is the carpal tunnel itself, and we could thread a needle through the carpal tunnel to bore open more space.
Oh, wow. Okay.
So we'll actually go below the carpal tunnel and thread it through. Now, this only works for the mild to the moderate. In the extreme carpal tunnel, where it's hot, red, swollen, and tight, it can actually make it worse. If it's an extreme case, then stomach 41 at the flexor retinaculum of the foot on the opposite side is the main carpal tunnel point. And there's a connection in the body, arm and leg, cross arm, ipsilaterally from foot to hand, from quadrupedal movement. If we believe in evolution, that we once walked on all fours, there's a fascial plane going from opposite hand to opposite foot. And there's a recognition in the body, if one of the retinaculums opens, the others do as well in syncytium. So releasing the opposite foot's flexor retinaculum releases to some degree the opposite hand's flexor retinaculum.
Wow.
So stomach 41 is a fabulous carpal tunnel point, and some acupuncturists only treat carpal tunnel from that point. Now, I'm a little more aggressive. I'll go up to stomach 12, which is where the median nerve goes under the clavicle.
Yep.
Lung 1, lung 2, pericardium 2, pericardium 3 at the wrist crease, pericardium 7. All of these are ways that can be used to physically open up the tissue so that the nerve conducts more readily. Electricity can be used along a nerve path, but sometimes it's very uncomfortable. That's more helpful when the nerve's actually gone dormant or asleep. If it's been trapped so long that it's not conducting well, you can stimulate the nerve, and the nerve might actually increase in function. So for that, electricity works. Another way that's less risky is moxa, using fire. Heating the nerve path through that area both increases blood circulation through heat. When we get hot, we get peripheral vasodilated. So the blood increases and then the tissue softens up. But we can also stimulate the nerve because the nerve's there to receive signals such as pain, and heat is one of those stimuli that stimulates the efferent nerve fibers. So we use moxa. And moxa the heck out of the hand. Like, for instance, my partner Carrie treated a banjo player that had a cut on his wrist that severed his median nerve, and the Western medicine physician here, the orthopedic, said, you might as well look for prosthetics. We have nothing we can do. And she did moxa, herbs, and electro and regrew the nerve within a year, and he's now playing banjo full speed again. So it is possible to stimulate nerve growth through some of these methods of palpation, pressure, acupuncture, electricity, and heat. So I just do the whole thing on the pericardium. Now there's another therapeutic that gets a little more esoteric, and that's the emotionality behind the pericardium. In Chinese medicine, the pericardium is the arm Jue Yin. The name of the meridians that we call them as Westerners, i.e. pericardium, is not the real name of the meridians. The Chinese had their own names for the meridians before we put our system on it. And the Chinese call it the Jue Yin, the arm Jue Yin. The leg way in is liver. So liver and pericardium are the middle of the arm, the middle of the inside of the leg. They're paired meridians. What I'm telling you here is the liver sometimes has to be decompressed for the pericardium to open. What this means emotionally is if somebody's too pissed off because they got hurt, they're not going to hug. So they got to get over the anger, let go of the anger so that they're willing to hug again. So that's, if somebody's in that type of a case, we got to clear the liver, soften the liver, release the liver. Either herbally, massage, gestalt therapy, give them a tennis racket and pillows and have them scream it out until they're done. Whatever it is they need to do to let go of their liver, then the pericardium will decompress, the meridian will decompress, and the nerve will be decompressed.
That's cool. So how do you pick that up? Is that in the tongue, or like you just like
it will be shown in the tongue. The tongue will be all tight and quivery. If there's a liver component, it'll be tight and quivery. It could be in the sound of their voice, if they're very sharp and shouting. It could be in their clothes. They come in full combat gear with wrinkles between their eyebrows, and they're talking about how pissed off they are about everything, pissed off and pissed off and pissed off and pissed off. And okay, we got a liver component going on.
Cool.
So if it's a carpal tunnel and the pericardium channel's rigid as can be, and they're all liver presenting, then we got to free up the liver to soften the pericardium. Good luck softening the pericardium if you don't deal with the anger.
Yeah, right. Yeah, you can spend all day.
If they're so pissed off, they're not gonna open.
They're not gonna open. Yeah,
no,
that's cool.
And then see, that's with the ulnar nerve neuropathies, it's a lot more difficult because the ulnar nerve neuropathy is heart, small intestine. So now we got to talk subscapularis, infraspinatus, and teres. That whole thing that's where the muscular contraction, levator, supraspinatus, infraspinatus, teres is what triggers the ulnar nerve. And then if you can get that released, then you got to release subscapularis. So yeah, that's where the differentiation is. This heart, small intestine, or is this pericardium, or is this lung, large intestine? Because that'll describe the emotionality and the location by which the acupuncture, massage, and matza need to be applied.
Yeah, nice. Yeah, so if it's actually heart and small intestine and you go working on pericardium, you're not going to really do terms. Yeah.
Well, that's an unusual case because the pericardium is related to the heart, small intestine. If you get somebody to open their pericardium, their heart might open and their small intestine might open. But it's not the direct cause. And if it's lung, large intestine and you're playing heart, small intestine, it ain't going to work.
It's not going to work. Yeah.
And if it's really a heart thing, if it's if subscapularis is pinched so tight that the scapular blade is being drawn onto the chest wall so tight that it's pinching the ulnar nerve as it's going across from the cervical plexus, the subscap has to be released. And to release subscap, either through massage or acupuncture, is quite it's a very deep experience for people.
Absolutely. Yeah, right. It's back of the heart, right?
It's as close as you can get to the heart from the outside without touching the heart. That's where the deep heart wounds get held, So deep heart wounds can cause neuropathies, but it'll be more on the ulnar nerve, going to the pinky. Yeah. The neuropathies going down to the middle finger is more the fuck off, I'm not going to hold you. Ah! And then if somebody has that thought as they're using the keyboard, they're going to get carpal tunnel more than the person's like, oh, I could hold this is cool. All right, right on, I could do this. I could hold this is cool. So that's why one person doing one job and another person doing the exact same job may and may not get carpal tunnel, because it's a reflection of their internal ideologies, how they're holding their body. How we think and feel dictates our form, the form of our flesh, and the form of our flesh dictates our symptoms. So it can't be neglected. We can't just say it's the flexor retinaculum, cut the flexor retinaculum. It might work some of the time, but there's a whole other thing going on behind it.
And that may well explain the recurrence of symptoms. Like if the thought forms are still held, then, it's they're going to get it back.
Uh-oh.
Oh, we're back. It's cool.
All right, cool.
All right, buddy. How you feeling? I'm feeling pretty done on this one.
Yeah, my next client's waiting for me.
All right. Well, thank you.
Love you, Tom.
I will see you again soon, hey? And do another one.
Yeah. What's our next subject?
I forgot. What is it? We did talk about it. Was it the pregnancy one? Or no. PMS.
Oh, okay. Yeah, let's do that one next.
Yeah, let's do that one. Premenstrual syndrome. So that should be super interesting.
Sure hope this helps the people of the world. I hope this educates people to better understand what's going on for them and how they can better live their lives and seek medical care to help them out.
Yeah, me too, buddy. Me too. All right, I will see you next time. Take care of yourself and aloha.
Aloha, Tom.